Understanding mental health for faith-based audiences. The topics we will be discussing in this video are warning signs, mental health promotion, mental health prevention, and resources. Before we begin, it is important for everyone to think of mental health challenges as being on a spectrum. Some people can face strong emotions and feelings that occur situationally and do not necessarily impact their day-to-day life, but others can experience challenges so severe that they impair their ability to function day to day. Did you know? 1 in 5 adults in the U.S. experiences mental illness each year. 1 in 5 youth aged 13 to 18 experiences a severe mental disorder at some point during their life, 13% of children aged 8 to 13. Just over half of children aged 8 to 15 received mental health services in the previous year. Half of all chronic mental illness begins by age 14, 3/4 by age 24. African Americans and Hispanic Americans use mental health services at about 1/2 the rate of Caucasian Americans in the past year.
What to look for in adolescence. Sometimes it can be difficult to tell the difference between behaviors that are typical and behaviors that are abnormal, but there are some common warning signs of mental illness that caregivers, family, friends, and educators should look for in adolescence. Some of these warning signs include excessive worrying or fear, feeling excessively sad or low, extreme mood changes, changes in sleeping and eating habits, abuse of substances, inability to carry out daily activities, and many more. What to look for in children. There are also warning signs that caregivers, family, friends, and educators should look for in children as well. Most of the symptoms for children are behavioral, since they are still developing and learning to express their thoughts and emotions. Some of these symptoms include excessive worry or anxiety, hyperactive behavior, frequent temper tantrums, and many more.
Mental health promotion and prevention. Mental health challenges can cause a great deal of burden on children and parents. Just like our physical health, it is equally as important to take care of our mental health. Here's some suggestions of ways you can improve your mental health. It is important to talk to people about feelings that may be impacting your life, whether it be with a trusted friend, family member, educator, or therapist. It is also important to keep up with your physical health through exercise and a healthy diet. Lastly, in your hectic, busy life, it is critical to take time for yourself and do things that you enjoy, such as reading, cooking, or exercising. The following are some suggestions of ways you can help your child improve and maintain mental health. It is important to be a good role model for your child in terms of how you express emotions. Each parent has their own way of disciplining their child, but it is important that you make sure they are learning from their mistakes and you are consistent with how you utilize effective punishment methods. Lastly, each child has limitations and things they struggle with, but it is important to celebrate their accomplishments and strengths. If you think your child may be at risk for developing a mental health challenge, there are several steps you can take. For example, you can speak with your pediatrician, get a referral to a mental health specialist, work with the school, or connect with other families. Mental illness can have a big impact on a child and their quality of life. A large number of students with mental illnesses that go untreated are at higher risk for dropping out of school and having low academic achievement. Children with untreated mental illness take up 70% of the juvenile justice system.
Now here are some resources with beneficial information that can possibly help your loved ones on how to deal with their mental health condition, where to seek help, how the people around them can aid in their recovery, and how faith can help through this time. How can others help children and teens with mental health challenges? Parents and caregivers. Parents and caregivers should be aware of their child's symptoms because if symptoms are left untreated, this could cause their condition to worsen. When parents and caregivers do notice something different, they should contact a professional. Parents and caregivers should also educate themselves on mental health, including your child's specific mental health challenge and the various treatments for it. Talking to your child's school is very beneficial for the child as they could be given the proper attention that they need to accommodate for their condition. Making sure that you are respectful for your child is equally important, as you do not want to get angry with them even if times are tough. Another way that parents and caregivers can help their child is making sure that you are taking care of yourself and your family. Sometimes the stresses of your child's mental health challenges can cause mental stress in your own life, so make sure that you are taking care of yourself and talking to someone if needed. Taking care of the rest of your family is equally important, as you do not want any of your other children to feel as though they are being pushed to the side. Finally, having the whole family being educated and advocating for your child with mental health challenges can create support for yourself and your child. First, discuss your concerns with your friend to show that you are looking out for them and care for their well-being. Also, involve other people that the child and teen knows well so that you don't have to go through this alone. Lastly, always offer your support so that your friend knows they can rely on you. That's all I have. Educators. It is important that educators educate the staff and other parents as well. Also, creating a positive and safe learning environment and providing access to school-based mental health programs is equally vital. Community and faith leaders. It is important that you educate your community as well as connecting families to help in their community. Being supportive is also important, and identifying opportunities for support. Mental health screening tools. If you are concerned about your mental health challenges, there are various mental health screening tools that you can use that can be found on the Mental Health America website. Mental health and faith. Evidence has shown that faith can improve mental health by offering support and a common understanding of one another. Personal stories. If anyone is interested in reading about individuals who have mental health challenges and have used their faith to overcome their struggles, you can type any of the following bolded titles into Google to read their personal stories. For more information, here are some mental health organizations and associations.